Hi, I'm Cheryl Abrigo with USF Tech Transfer, and this is our tech tour with Dr. Albert Kim, who is the Director of Acousto Bioelectrics Lab and Assistant Professor in the Department of Medical Engineering. Hi, Dr. Kim. Thank you for being with us today.
Hello, thank you for having me this morning.
So first of all, can you tell us a little bit about your path that brought you to USF?
Yes, so I've been in academia for about 6 years now. So before I come to USF, I was assistant professor at other university, and I was also in other industry before. So my career path in engineering, biomedical engineering, has been about a decade.
Wow. Wow, okay. You don't even look that old.
Okay, thank you.
Can you tell us a little bit about the research? I know you have some devices here. Can you explain a little bit about what these are and what they do?
Yes, absolutely. So this technology, so I brought some example here. So it represent our research very well, so-called acoustic bioelectronics. I define it as the study of acoustic energy in biological system. For example, we utilize the transduction of ultrasound for clinical application. So this little device, it can be implanted in the brain tumor, and it generates chemotherapy agent. And this agent called the cisplatin. And cisplatin is currently used widely in the clinic today. So to explain how this device works, for example, here, let me take it. So this is a little one. So to explain how this device works, I have to explain the history of the cisplatin. Very first and the monumental discovery was actually happened by accident. Dr. Rosenberg back in 1965, he was studying electric field effect in E. coli bacteria, and he happened to use a platinum electrode. And later in his study, he discovered that electric field actually causing the platinum compound, which stopped the cell division. Nowadays, cisplatin is treating almost 40% of all type of cancer. So this little device, it exactly reproduced Rosenberg's experiment. The difference is it happened in the micro device level. So once it implants, doctors that administrate ultrasound, and this little device convert acoustic energy into electric field and induce a cisplatin. And because of this, as you see, this is very small, and cisplatin generating from the cancer level, we expecting efficacy is very high, and it also reduced the side effects such as vomiting, nausea, and such things.
Cool.
Thank you.
What inspired you to do
So yes, so as I mentioned, I've been working in acoustic bioelectronics research for over a decade. And while I'm working on, I receive a phone calls and email from friends and family of patients. And they asking me if they can try our technology. Yet it's too early, I told them. But their story is pretty much heartbreaking. And especially this brain cancer, it is a deadly cancer and with the lowest survival rate. And unfortunately, there's not much of a therapeutic option today. And even though the patient survive from the brain cancer, it usually leave the permanent damage to the brain. And because of that, and I motivate to develop very translation medical device like this.
Mm-hmm. Great. So your ultimate goal, where would you like to see this go?
Absolutely. So as I mentioned, I want to help them. My ultimate goal is to take this little device to the clinic and hopefully save a patient who is suffering from the brain cancer.
So I want to go back to the technology just a minute. So how does the ultrasound react with the device?
So ultrasound is pretty much a standard in the clinic today. So especially for imaging application. So that means it's very adapted to patient and doctors. And we also use the ultrasound just to induce the electric field, basically converting acoustic energy into electric field using like little tip over here. So this is a so-called piezoelectric material. It is a material that converts mechanical to electrical conversion.
So it isolates the treatment. So
yes.
Okay, which is very important, right?
Yep.
Thank you so much.
Thank you.
This has been very interesting. I am Cheryl Abrigo with the USF Tech Transfer Office and Dr. Albert Kim. Thank you.
Thank you very much.